Hello, thanks for listening to the Total Knee Tips and Pearls podcast. This is Adam Rosen, your host. I'm a fellowship-trained orthopedic surgeon who specializes in joint replacement. In these episodes, I'm going to share with you a lot of my tips and tricks and review classic articles and current implant designs. Thanks for tuning in, and on with the show. Hello, welcome back. This is Adam Rosen. You're listening to the Total Knee Tips and Pearls podcast. So on today's episode, a bit of self-promotion, and I just want to talk to you and introduce to you a project that I've been working on actually now for a couple years, and I've now finished, and it's my new book, or my first book. It's a nonfiction book, which was designed and written for patients and to patients. It's called The Knee Book, A Guide to the Aging Knee. So I want to share this book with you for a couple reasons. One, I think it's really important to be able to talk to patients and be able to explain things to them in a way that they understand. And I think hopefully if you've listened to some of my previous episodes, you'll hear me describe things in different ways when we're talking about the preoperative discussion. And the hard part is that every patient's different. Like their level of understanding or education is different. And even what may make sense to somebody, if you describe it one way, may totally confuse somebody else. So you may have to have multiple ways of describing the same thing. But a lot of patients have questions. So when I give my lectures and talks, and I speak with patients in the office, I hear over and over again, patients come in for a second or third opinion, and they're just so happy with how I explain things. They fully understand what's going on and where they're at. And again, I don't think that's anything to discredit the understanding or intelligence of a doctor that they saw previously. It's just they may not have had a good way of explaining what they knew to the patient in a way that the patient understands. And patients, especially right now with COVID, have a lot of difficulties with access to care. There's also a big issue, I'm sure, if you've run a lot of clinics with your attendings, or if there's attendings that are listening. We all deal with patients that have a lot of the same questions. Why do I need an x-ray? I already had an MRI. And what are you going to do about the meniscus tear? And why do I have a Baker cyst? And discussing the risks and the complications of surgery. These are things we talk to people every single day about. So I took all of that information and all the lectures that I've given over the years, and I put this all together in this handbook for patients. And I really hope that a lot of people that are out there with knee pain read it, because I truly believe that if patients read this, they will come into the office probably later, because the basic questions when they have minimal arthritis and they haven't tried anything, this at least gives them a platform of, if I'm overweight, I do have to lose weight. And if I'm not exercising, I do have to exercise. And I can take these over-the-counter medications and they may help my symptoms. But it's also going to answer a lot of the questions that they may have going forward. So maybe they're at the point of surgery, and understanding what a knee replacement is and what the risks are and what the expectations are and what the importance of rehab is will help the doctor that's seeing these patients in the office. So that's where I would sort of gear this in a couple ways of, one, now that you know about this book, if you see patients that have knee pain, that have lots of questions, this is a great book and resource. It is up to date. If you look back, there's been a bunch of books in the past, and some are very more specific on knee replacement, but they don't really cover what happens before you need a knee replacement. What does arthritis mean, and what does the MRI mean? What is a Baker cyst? This book goes through that. So chapter 1, I really describe just the basics of what a knee is, and in chapter 2, I go into the symptoms and discuss the imaging, and again, why we think it is so important that patients get standing weight-bearing x-rays, and why also we rarely need MRIs. Chapters 3 and 4 go into exercise and the importance of weight loss. Chapter 5 goes into over-the-counter medications and treatments that patients can do to treat their symptoms on their own. Chapter 6 gets more into the non-surgical medical treatments, so more of the things that we can do, such as injections. Chapter 7 touches on arthroscopy, and again, it's not a sports-related book, so it really discusses and explains that we can't always treat people with meniscus tears if they have a meniscus tear on the MRI with arthroscopy and make them better if they have arthritis. And then chapter 8 goes into knee replacement, the surgery in detail, what it is, what to expect, and what the risks of that surgery are. And then chapter 9 goes into the rehabilitation following knee replacement surgery. And chapter 10 sort of touches on some of the future things that we're going to see going forward. So it really encompasses the whole thing. Now, why is it also important? So there's two other groups of people, and this is actually why I'm talking to you, is I think this is a great resource for medical students that are going into orthopedics, orthopedic residents, and even orthopedic surgeons that are out of residency and maybe in their first couple of years of practice. Why? I think a lot of residencies, the goal of residency, right, is mainly to understand and know how to operate. We know the classifications, we can discuss the risks, and we can, go over all the details. But some residencies, more than others, you might have more time in the operating room. You may not have as much time in the office. And you may not be exposed, even if you are in the office, to a lot of knee replacement stuff if you're going into that realm of joint replacement. But we're all going to see patients with knee pain. And what I find is a lot of even our fellows that come through, they understand the specifics. And in our conferences, they can discuss it in a very, educational, scientific way. But having the verbiage to be able to explain these things to people, to your patients in the office, in a way that they understand, that's the difficult thing. So if you've heard me talk about some of my analogies, this book shares all of those analogies. So feel free to use those analogies with your patients. Read this book. And again, because I would never recommend a physician recommend a book to a patient if you haven't read it first, because you don't know what's in it. But if you read it, you will have all of those analogies in your head. And I guarantee that you'll be talking to some patients and they're going to have questions and they're going to want to know why. They're going to have questions for you as to why does this hurt and why don't I need that and what about this? And in this book, you'll learn all of those analogies and you can use them to better educate your patients and better explain what they're going through. The other group of people that I really think would benefit from this are non-orthopedic healthcare physicians or nurse practitioners or physician assistants. Anybody that's working in the healthcare field that treats a patient with knee pain would benefit, because we all know, and there's studies that show this, that the musculoskeletal knowledge of people coming out of medical school is not good. And how do we make that better? Well, that starts at the medical school level of education and treatment. But if they're already out, what else are you going to do? So this book is a great resource. Like if you have a primary care doctor, maybe you have a friend in residency in primary care, recommend this book and go, hey, look, you're going to see people. This lets you know the algorithm that we follow in orthopedics. This is why strengthening is important and weight loss is important and over-the-counter medications are important and narcotics are not recommended. This is why we tell you to get weight-bearing x-rays and not order an MRI on an arthritic knee. And it even goes into the idea of risks and optimization and why when we send people for preoperative stratification and optimization, what things are important and why. And I really think a lot of non-orthopedic providers of health care, such as physicians and PAs and nurse practitioners, would really benefit from this book. And it also gives them this other thing. Again, if they read the book and they understand it, and their patient comes in and has lots of questions, it may not just be refer to orthopedics, but it may be, hey, refer to orthopedics, and you should probably pick up this book because it's going to answer all of those questions. So I will put a link to the book in the show notes, but definitely I would strongly encourage you. I'd recommend, check it out. I really do believe it's going to be an easy read if you're an orthopedist. I've proofread this a billion times, so I hope at this point there's no errors or spelling errors or grammatical errors at this point. But I think for an orthopedist, it's a very, very easy read. You could sit down and read this probably in one setting. But it'll make a lot of sense to you, and it will give you that understanding, again, of the algorithm, not just of how to do the surgery, but how to treat patients in the office, especially the ones that don't need surgery, and how to work them up and get them through to a point, if they need surgery at that point, that you've covered this whole algorithm and you understand how to talk to them. Because that, I think, is the biggest thing that we can do, is learning how to educate our patients and make sense of the confusion of their symptoms and what treatment options are available, and making sure that they have realistic expectations if they then need or choose to have a knee replacement surgery, that they have realistic expectations of what it is and what the requirements are for them as far as physical therapy to obtain a good outcome. So thanks again for listening. I'm Adam Rosen. You've been listening to the Total Knee Tips and Pearls podcast. Until next time, stay safe. You've been listening to the Total Knee Tips and Pearls podcast. Make sure that you're subscribed so you'll be notified of future episodes. And please take the time to leave a review. It helps other people like you find the show. Until next time, stay safe.